Are your hips able to fully flex without pain or tension? The hip is a ball and socket joint. The head of the femur sits inside the acetabulum of the pelvis, which is surrounded by a labrum that helps deepen the socket, and all this is held in place by strong ligaments and muscles. One of the most important movements of the hips is to flex. The hips should be able to flex about 120 degrees, which is like bringing the knee to the ribs on the chest. It's hard to live with hips that don't function well. It can be difficult to walk, sit, or bend over to pick something up. It's all using the hips to flex, and it can lead to hip pain if they're not fully flexing. It also puts more pressure on the low back when the hips aren't functioning well, which can lead to low back pain. If flexion of the hips is less than 120 degrees or painful, it could be due to several different things. Labral tears, hip dysplasia, bone malformations, or osteoarthritis can all affect this hip motion and cause pain. As well, fibrous adhesion of the muscles and ligaments of the hip joint can restrict hip flexion and cause pain, or make those underlying problems even worse. Do you have x-rays or an MRI of your hips and are considering hip surgery? Try that hip flexion test at home, and if it's limited or painful, come see us to review your images with you and find out if we can help delay or even avoid hip surgery.